Did you know that vitamin D isn't just about weak bones? It's directly linked to severe knee and hip osteoarthritis pain, worse mobility, and even a higher rate of ACL tear and re-tear requiring a revision. In this video, we're diving into 4 different research papers to show how optimizing your vitamin D level can help decrease your pain, increase your function, and protect your knees, hips, and possibly shoulders long term. I'm Dr. Tammy Penhollow, a spine and joint care specialist, and you are listening to Mobilize and Energize. Let's dive in. So we're going to go over 4 studies. I'm not going to pull up every single paper right now in the talk, but they will be linked below if you want to get into the details of exactly how many people and the research specifications. Optimizing vitamin D is so important, and this is not the first time we've talked about it, but it's the first time that I've put it together in 4 papers because I think the data just keeps growing and growing. Low vitamin D is detrimental to your musculoskeletal health, not to mention all the things we've talked about with the benefits of your overall mood and overall well-being and those things. Let's get specific with some of the joints, because these studies talked about some of the joints. So very specifically, it decreases chronic inflammation when you've got a situation such as arthritis, and that's about the knee or the hip in these papers. People who had low vitamin D levels had increased pain. They had increased disease progression, meaning that if we're looking at the cartilage and we're looking at low vitamin D, that the degradation of the cartilage occurs faster if the vitamin D levels are not corrected. So you're going to advance from a mild to a moderate to severe osteoarthritis and be recommended for a joint replacement faster unless we can correct that vitamin D level. It's very protective. So there's less disease progression, less cartilage damage if you replace the vitamin D and get that optimized. Vitamin D levels that are higher in a study of 257 males showed that they had decreased pain. It didn't pan out in females, but this is, less than 300 people. So I'm sure that if we had a large enough sample size that it would also show the same in females. We also have a decrease in vitamin D if we've got increased pain, greater functional impairment in this 257 people, because they expanded upon not just the vitamin D levels, but they looked at some very important inflammatory markers that we deal with in the biologic space. Interleukin-6 and tumor necrosis factor alpha, TNF alpha. Those levels were increased in a decreased vitamin D situation. And we talk about it in regenerative orthobiologics, how if we use platelet-rich plasma or bone marrow aspirate concentrate, we are counteracting those IL-6 and TNF alpha markers. So this is highly correlated, and it's really why I optimize vitamin D in every single one of my orthobiologics patients. I do it any patient anyway, but well before we'll even draw your blood or take your bone marrow to use your cells, because those 2 markers are so important. Now let's kind of switch to the ACL. What's the ACL? That's this anterior cruciate ligament. So that is something that the crossing ligament here, see the one that goes right down the middle here, crossing. There's an ACL, anterior cruciate, and there's a PCL, posterior cruciate. When athletes tear their ACL, it can be devastating. It can be season ending, and in some cases it can be career ending. We hope that's not the case. If it's an isolated ACL injury, then you often have an ACL repair, and they often use grafts. So let's break down who's more likely to get an ACL tear. Well, number 1 is basketball. Then we talk about soccer and football and lacrosse. Think sports where you're doing explosive movements with those quads. That's going to become important here in a second. Those rapid position changes from right to left and pivoting and side to sides, because the ACL helps stabilize that. So in a database of over 328,000 people, this is large. If you have decreased vitamin D levels, you are at an increased risk for an ACL tear. How much of an increased risk? 81%. That's huge. And if you've already had an ACL tear and then an ACL repair, continue to have vitamin D deficiency, you are at a 28% increased risk of re-tearing and then requiring a second surgery to repair that ACL graft. Crucial. If you have a low vitamin D level related to this, you're at an increased risk of soft tissue failure in your rotator cuff graft or in an ACL graft. So this is body-wide. It's not just about people who are lower extremity athletes. Has to do with the upper extremity athletes too. And that's because we talk about vitamin D and it's important in the explosive muscles. And in this case, the quad muscles in the ACL, and then think about the rotator cuff muscles themselves, and then the surrounding things like the biceps and the triceps and the shoulder. So vitamin D, let's kind of break that down, because you say, wow, I'm at increased risk, or how do I know I'm at increased risk? You need a blood draw. We do the 25-OH or the 25-hydroxy because that is the most active form. It is more representative of what's kind of in the tissues. So we'll get a vitamin D 25-hydroxy, and the normal reference range is 30 to 100. That's super broad. It means less than 30 you're deficient. A lot of very conservative people will want to bring your level between 30 to 40. I push my patients a lot higher than that. I found that the increase in musculoskeletal particularly, but also with overall things such as mood and sleep and all the benefits of vitamin D, I push to the 60 to 80 range. But if you're not my patient, don't do that. You need your own physician to be monitoring this. Why? Because vitamin D is a fat-soluble vitamin, meaning that if you get excess, you're not just going to pee it out like if you have vitamin Bs. The Bs are water soluble. If you take this monster mega vitamin B complex and you have excess, you're just going to excrete the rest in your urine. Not a big deal. However, vitamin D accumulates in the fat, and you can be floating along here at this range, and all of a sudden the fat becomes saturated, and then you catapult into a range where it is not safe. And literally the D, E, A, and K vitamins, who are all fat soluble, an unsafe range is a big deal, and you could lead into liver damage and other things. So this is not something to DIY. You don't just want to willy-nilly go out and buy the biggest vitamin D dose you can at like 10,000 international units and start taking it every day. You need to be monitored on this. You need blood levels. You need to have somebody that is focused on this for you. And I would highly recommend that before you consider using any of your cells for a therapy such as platelet-rich plasma, bone marrow aspirate, micronized adipose, that you optimize those vitamin D levels, and that you find somebody who's going to do the therapy that actually wants to know what your vitamin D levels are and to optimize them. If you're an athlete, talk with your sports med doc. See if you can't get the vitamin D hydroxy levels measured and optimized, and they can follow it and make sure you safely do this. So I want to keep you on the field, on the court, and in your life. But vitamin D is one of those things to keep an eye on and know that it's out there in the press right now. And it's really exciting that we can improve performance, possibly decrease the progression of osteoarthritis. That means that it's technically what's called a disease-modifying drug. Fantastic. If you have any questions, please like, subscribe, and put any comments below. I'd love to hear what you have to say about vitamin D or anything else on the channel. Again, Dr. Tammy Penhollow, Precision Regenerative Medicine. Thank you.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.